trouble concentrating, all of those things, the joint pain. Do you have these symptoms? If you do, it could not just be what you're putting in your body. It could be about all those hormones in your body. And there may not be a prescription for you. It may be all natural. So here with some life-improving information, Dr. Stephen Hotze from the Hotze Health and Wellness Center, and one of his patients, Rose. And I think, Dr. Hotze, let's first talk about, let's get some information from Rose, because Rose, your story is actually really quite interesting and very poignant. At one point, you really were so sad and depressed in some way that you really wanted to take your life.
That's true.
And so tell us a little bit about what happened.
Actually, it started in 1998. I became very ill, just out of the blue. Was going to cardiologist, rheumatologist, endocrinologist, GI doctor, many different symptoms. Just very ill, fibromyalgia, IBS, migraines, all types of things were going on, and I didn't know why. Went back to my primary care doctor after seeing all of these other individuals. And he pulled out my chart, which looked like War and Peace by that time, and he said, everything's negative. So you know what that means. And I had no idea what that meant. He said, you're depressed, and here's a prescription for Prozac. Go home, take this, rest for a few days. Went home, took that, started climbing the walls, all kinds of side effects. Went back, he said, well, you're also suffering from some anxiety. Let's send you to a psychiatrist. Actually, not too long ago, had found a list, an instruction list of prescriptions from 2000, and I was on 8 drugs.
Ooh,
8 drugs. 8 drugs.
And that's when you went to go see Dr. Hotze.
Actually, it lingered on for a while after that. That was the same year that I was hospitalized. That was the same year where I got to the point that I felt I'm going to hurt myself. I was so incredibly depressed and in pain. A lot of people don't realize how much physical pain goes along with that.
Well, tiredness and depression.
Exactly.
And the IBS, I mean, irritable bowel syndrome, those are all, you know, really, those are all symptoms that have medications for them. But Dr. Hotze, you're saying that that traditional medicine, that prescriptive drugs, you don't need them in this case.
Well, they don't solve problems. People aren't sick because they have low level of drugs in their body. We develop problems in midlife, particularly women, as our hormone levels decline and become imbalanced, and that adversely affects the way we feel, and it is accompanied by a host of symptoms, many of which Rose has had. And unfortunately, when she went to see her physician didn't recognize that because he probably hadn't been trained to think about women's health problems as related to hormonal imbalance. So when all the tests came back negative, all he could offer her were drugs and antidepressants and sleep medications and anti-inflammatory, and the more she took, the worse she got, till she ends up in the hospital.
But you have an alternative.
Well, we do.
and not hormone replacement. I mean, the hormone replacement that we normally hear of with perimenopausal and menopausal women, these are prescription hormones. You're talking about naturally occurring hormones.
The hormones, that's right. We talk about biologically identical hormones and natural thyroid. These are prescription medications, but they differ from the counterfeit hormones produced by companies like Wyeth, Premarin, and Prempro, because those are not natural occurring hormones in women. Now, Premarin is a hormone that occurs naturally in horses. It's derived from horse estrogen from pregnant mare urine. That's where they get Premarin. And Prempro is a counterfeit estrogen and counterfeit progesterone. When you put that into a woman's body, you have a host of health problems. Women will tell you that they don't feel well on this. And the Women's Health Initiative showed that when women take that, they have a dramatic increase of breast cancer, heart disease, strokes, blood clots to the lungs. Why? Because they're not natural in our body. So why would we want to put something unnatural in our body when we can put something that's identical to what our body used to make in adequate amounts? And those are the natural occurring hormones. And in women, it's the natural occurring female hormones.
So what's the age range that you see the most of?
Well, average age of a woman we see at the Hotze Health and Wellness Center is 45, but we see young girls at puberty. Many girls come in and say, I haven't been right since I started my cycles. And some women, young girls, they have problems, irregular cycles, they get premenstrual symptoms such as breast tenderness, mood swings, fluid retention, weight gain, and headaches and migraines. They go to the doctor, they put them on birth control pills trying to regulate their cycles. Well, those are counterfeit hormones too, and they turn off a woman's natural occurring hormones. So she's on these birth control pills, which have a host of problems in themselves. They're not dissimilar to the counterfeit hormones that the Women's Health Initiative said caused all these problems. So what would you do? How do you treat a woman? What's the big problem? Well, the common problem in women is the decline in progesterone and not enough natural progesterone, which is the hormone of the second half of the month. In a menstrual cycle, a 28-day menstrual cycle, you make estrogen. A woman will make estrogen all 28 days. She'll ovulate mid-cycle and make progesterone. She has to have a balance of these two. It's like a seesaw. And if they balance, she feels well the second half of the month. If they don't, then she develops these symptoms. And when those premenstrual type symptoms, and those can happen in teenagers and 20-year-olds and 30-year-olds. And as a woman matures, they tend to become more exacerbated. They get worse. Oftentimes after childbirth, women go like, I haven't been the same. Things have changed. I can't lose weight. I'm tired. I'm depressed. And they go to a routine conventional physician, which I was trained conventionally here at the University of Texas.
Right, you are a physician.
MD.
Right.
And I was trained, if you got a problem, we got a drug.
How soon, you've been
doing more natural approaches since 89.
89. So it was back then that you decided you were not going
13 years in, I had a little lady come into my office and I said, Miss Jones, how are you feeling? She said, Dr. Hotze, ever since I threw away all the drugs you're giving me, I feel like $1 million.
Oh, gosh.
So I knew.
So you knew that.
I knew that.
Right.
So that's when we began to look at alternative approaches that were safe, effective, and more natural, and simply replenish. As we age, our hormone levels decline. Right. And in women, they become imbalanced.
And then we don't want to necessarily have to get a prescription for them in terms of the typical, like you were talking, the Premarin and all of the things that we're used to. But we have some more solutions that are going to stay with us. And Rose, stay with us also, just in case we want to ask you a few more questions about how the hormones are doing for you. But so up next, as I said, we're going to be talking more hormones, how much this costs, how do you know if it's for you, and also it may be for men. You never know. There's some men out there with some hormone imbalances. So we'll be right back. Hormones. They occur naturally in your body, but for some, not as naturally as they're needed. So should you replace the hormones with prescription drugs or find alternatives? So joining us again, Dr. Stephen Hotze with the Hotze Health and Wellness Center, author of a very good book, which we're going to talk about at the end of this segment. There you go. Well, Hormones, Health, and Happiness, and I think we have one for all of our audience members.
We do.
I actually read a few chapters. It was in my hair salon. It was at Bella Renova. Yeah, I know. A lot of women are talking about this. But it's not just for women. It's for men, too. You have male patients?
Well, interestingly enough, we really focus on women because our goal is to give women hope. So when women go to the doctor, they're not made to feel like they're hypochondriacs or neurotics or hysterics and that their problems are psychosomatic, like Rose was made to feel.
Right. Rose is one of your patients. How long ago was that, Rose?
I began in April of 2005, so I've been with them about a year, a little over a year.
Are you married? Yes, you're married. And what about your husband? Are you trying to get him to go see Dr. Hotze?
Actually, he is the one that hooked me up with the center in the first place, because he listens to the radio program every day at noon. And he called me one day and he said, turn the radio on, hurry up, hurry up, hurry up. And so I ran and turned it on. I was on the phone with him. He said, hey, there are women that are calling in. They have all the symptoms you have. They're talking about the same issues. And this doctor is saying that they can help them.
And you know what, important for women too about weight gain, because you said you had gained a lot of weight. Well, you look fabulous now. So is there hormone therapy that you have for weight gain? Because I'm sure a lot of women want to know that. There are pills out there, diet pills, but... Well,
diet pills, of course, usually tend to be low-grade amphetamines is what they are. And so they can be a problem. Why do women gain weight? Well, it's twofold. One is a change in their hormones as they become imbalanced, and particularly low thyroid, which is very common in women in midlife. Very rarely is it diagnosed correctly. And then if your thyroid is low, that governs your metabolism, so your metabolism slows down. If you don't change your eating habits, you're going to put on the weight. Right. So if you can restore the hormones, replenish them, particularly your thyroid, and we use Armour thyroid, I don't use the synthetics, and rebalance your natural occurring female female hormones and then get on a good eating program, sure, you can lose weight, and a lot of weight.
So talk about costs, because if you're going in for this procedure, and you're looking at your doctor and you're thinking, well, my prescription drugs are going to be this much, and here's, my insurance pays for this, this, and this. If I go see you, we're not talking insurance, because it's an alternative type of medicine.
That's right. Coming in to see our practice can run anywhere from $2,000 to $3,500. It's going to cost you about $100 a month on your hormones. We've trained 19 other physicians in town to use our methods because our goal is to give women hope, so they're not buffaloed into thinking they have to take antidepressants and there's some kind of psychiatric wrecks the rest of their life, which ruin their marriages and ruin their careers and their jobs. Women can be perfectly healthy. All you have to do is replenish your hormones with the same hormones God put in your body to begin with. This is not rocket science.
Yeah, well, we talked all about how much money is being spent these days on sleeping pills and on Prozac and the Prozac Nation book.
Prozac, it costs you $140 a month just for Prozac.
Really?
A month.
Goodness gracious,
and you
that's
can
a
get,
whole lot of do-re-mi.
why not get well and get off all the drugs, which Rose did. Rose, are you on any drugs? Are you on any of those drugs still?
No.
She's completely
off. All right, well, give it up for Rose, too. Rose, thank you for being here. Everybody gets one of these books. Everybody gets one of Dr. Hotze's books in our audience, and also they can be found on your website, right?
drhotze.com, drhotze.com.
It's H-O-T-Z-E, Hotze. All right, thank you so much, Dr. Hotze, for being here.
Pleasure to be here.
No problem. Well,